Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. We have great news this week. The Pfizer mRNA COVID vaccine has been approved for kids between the ages of 12 and 15. The study that this approval was based on showed that there were no cases of COVID in the kids who received the vaccine. It's available at big vaccine hubs and at your local pharmacies, and will soon be available at many doctors' offices. Also this week, the CDC has updated its recommendations for vaccinated people. Now they say fully vaccinated people are free to go without masks in most settings. There's been a drop in coronavirus cases across much of the country in the last few weeks, and research indicates that vaccinated individuals are much less likely to transmit infection to other people. You'll still need to wear masks if required by state or local laws or by businesses, and people should still wear face coverings and physically distance when going to doctors, hospitals, or long-term care facilities, and when traveling by public transportation or traveling by plane, including at the airports and bus and train stations. While this is very exciting and what we all hoped would happen, there are a couple of cautions I want to give. If you're immunocompromised, please talk to your personal physician about your particular risk and the safety of relaxing restrictions. You may not have as much protection from your vaccine as immunocompetent people have, and you could be at increased risk for complications if you get COVID, so you may want to continue to mask and distance. Also, if you have unvaccinated family members at home, like your kids, or people living with you who are immunocompromised, you may also want to continue to be very cautious. Also remember that essential workers in grocery stores and other businesses are exposed to lots of people every day and are dependent on people to be honest about their vaccination status and to stay home if they have possible COVID symptoms. And they may be also tasked by their employers with the job of enforcing mask wearing, so please be respectful. And finally, it's important to remember to use just good old-fashioned common sense. If you're around people that you know are vaccinated and who would stay home to protect others if they're sick, then these recommendations make perfect sense. But if you'll be in close contact with others that you don't know, who may or may not stay home if they have possible COVID symptoms, then you may want to continue to mask and distance in those situations. The vaccines are not completely protective against all COVID illness. A small number of patients do have breakthrough infections after vaccination, but thankfully most of those are very mild. We've come a long way from a year ago. Let's enjoy the benefits of vaccination and encourage our friends and family to be vaccinated too. Thank you.